Hey everyone, and welcome. Today we're going to talk about a medication that's been around forever, since the 1960s actually, but its list of uses just keeps getting more and more surprising. We're talking about propranolol. It's a real workhorse in the medical world, and we're about to break down exactly what makes this one little pill so incredibly versatile.
All right, let's start with a bit of a riddle. What do heart attacks, crippling stage fright, and pounding migraines all have in common? I mean, they sound completely unrelated, right? Well, the answer is pretty wild. There's a single medication that can actually help with all three of them. So yeah, the answer to that puzzle is propranolol. And what's crazy is, this isn't some brand new fancy drug. Nope, it was first patented way back in the 1960s. And because it's been around for so long, we've had decades to figure out all the amazing things it can do. So what exactly is this stuff? Well, propranolol is part of a drug class called beta blockers. And a great way to think about a beta blocker is, like a governor on an engine. It basically finds these specific receptors in your heart and your blood vessels and just tells them to chill out, to slow down. So your heart doesn't beat as fast or as hard, and your blood vessels get a chance to relax. And believe it or not, that one simple action is the secret behind everything this drug can do. And this whole slowing things down idea has led to some really fascinating uses, taking propranolol way beyond what it was first designed for, which was, just treating the heart. Yeah, back in the day, propranolol was a total rock star in cardiology. I mean, it was the go-to for high blood pressure, for wacky heart rhythms like atrial fibrillation, and for that scary chest pain called angina. Doctors even use it during or after a heart attack because it can actually protect the heart muscle from more damage. It just eases the whole workload on the heart, acting like this powerful little shield. But its power over blood vessels doesn't stop at the heart. It's also used for something really serious called esophageal varices. And the analogy for this is just perfect. Think of them as varicose veins in your throat. Seriously. This can happen when someone has liver disease like cirrhosis and the blood pressure backs up into the esophagus. It's super dangerous. Propranolol comes in and helps lower that pressure, which can keep those fragile veins from bursting. Okay, now this is where things get really interesting for a ton of people. Today, one of the most common off-label uses for propranolol is for performance anxiety. And get this, it's not a psychiatric drug. It doesn't work on your brain's chemistry. It works by shutting down the physical symptoms of fear. You know that feeling. When you get anxious, your body dumps adrenaline. Your heart starts pounding. Your hands get all shaky. Well, propranolol literally blocks that adrenaline rush. It keeps your body calm, which makes it so much easier for your brain to feel like it's in control. It's also a huge help for a different kind of shaking, a condition called benign essential tremor. Now, this has nothing to do with Parkinson's disease. This is the kind of tremor that can make simple things like writing your name or just holding a cup of coffee almost impossible, and it often gets worse as people get older. Propranolol can really help steady those hands and just dial down the intensity of the tremor. And hey, for anyone out there who suffers from frequent migraines, this one's for you. Propranolol can be an absolute game changer. So one of the leading theories about what causes migraines is that the blood vessels in your brain start to spasm. Well, remember what propranolol does? It helps blood vessels relax. By doing that, it can actually stop a migraine before it even starts, which means fewer headaches, and the ones you do get are often less severe. Huge.
And one more. It's used to manage the symptoms of an overactive thyroid, also known as hyperthyroidism. When your thyroid goes into overdrive, it floods your body with hormones, which can give you a racing heart and make you feel constantly wired and on edge. So while the doctors are figuring out how to treat the thyroid itself, they'll often give you propranolol just to protect your body from all those intense symptoms. It's like a temporary shield.
So clearly, this is an incredibly useful drug. But like any powerful tool, you've got to know the downsides. So let's get into what to watch out for, the side effects, and some really important cautions.
This quote from Dr. Eric Richardson really says it all. He says, "The biggest thing that I warn people about is that it may work too well." And that's exactly it. The most common problem with propranolol is that it does its job a little too effectively. It can drop your blood pressure or your heart rate lower than you want, and that can cause its own set of problems. So what does that feel like? Well, it can make you feel kind of sluggish, tired, or even dizzy and lightheaded, especially if you stand up too fast. Some people might also get insomnia or nausea. But here's the good news. For a lot of people, these side effects don't last. They often just fade away after a few weeks as your body gets used to it, or your doctor can just tweak the dose a little bit. Okay, but some people really need to be extra careful. Because of its core mechanism, propranolol can actually make asthma symptoms worse, and it can even interfere with rescue inhalers, which is a big deal. It can also be a problem for anyone with Raynaud's phenomenon, that's when your fingers get really cold and painful, or for some people with heart failure. And this is exactly why talking openly with your doctor is it's absolutely essential.
All right, but out of all the warnings we've talked about, there is one that is in a class all by itself. It's so important, so critical, that it gets a special designation from the FDA. We have to talk about this one with the seriousness it absolutely deserves.
This is called a black box warning. You need to know what this is. It's the most serious warning a medication can have, and it's reserved for risks that could literally be life-threatening. It's designed to make you stop and pay attention. And for propranolol, this warning is all about what can happen if you suddenly stop taking it.
And here's the danger, laid out plain and simple. For people who have heart disease, stopping this drug cold turkey is a huge risk. Think about it. Your body has gotten used to propranolol, keeping your heart rate and blood pressure in check. If you yank that away suddenly, your system can have this massive rebound effect, potentially leading to severe chest pain, a heart attack, or really dangerous arrhythmias. So what does this mean for you? It is so simple, but it is completely non-negotiable. You can never, ever stop this medication suddenly. The only safe way to get off propranolol is to taper your dose down nice and slow, usually over a week or two, to give your body time to adjust. And this has to be done with your doctor guiding you every step of the way. No exceptions.
Okay, so we've covered the amazing benefits and the very serious risks. Let's put it all together now. When you understand it and manage it correctly, propranolol is an unbelievably powerful ally.
Really, it all comes down to a balancing act. On one side of the scale, you have these incredible benefits: protecting your heart, calming anxiety, controlling tremors, preventing migraines. And on the other side, you've got the risks: the chance of your blood pressure going too low, those possible side effects, and of course the critical danger of stopping it suddenly.
And this quote right here, this is the main takeaway. Propranolol is a remarkably effective tool, but its power absolutely demands respect. This is not a DIY medication. It requires a real partnership with your doctor to make sure it's working for you and not against you. You know, the whole story of propranolol, seeing it go from just a heart drug to this incredible multi-purpose tool, it's just a great reminder of how much there is to learn. And it leaves you with a really cool question to think about. As medicine keeps advancing, what other amazing, unexpected uses are we going to find for the common drugs we thought we already knew everything about? Something to think about. Thanks so much for joining me.